Thank you for joining us for our Wear the Gown special. I'm Bill Taylor. KENS 5 has teamed up with University Health for this community initiative to save lives. In the next 30 minutes, we'll be talking about the coronavirus pandemic. Experts will be giving advice on the safest ways to celebrate this holiday season. We'll also be talking about the vaccine and the new treatments being used to fight the virus. Tens of millions of Americans are traveling for the holidays this year, and that number is expected to be substantially lower due to the coronavirus pandemic. Jeremy Baker takes a look at how to stay safe if you do decide to hit the roads or the skies.
Whether you decide to travel by air or by car, there are many risks you need to consider for each circumstance. First, tackling the road.
You need to look at where you're going to go. Look at how many stops you may have along the way.
Dr. Jason Bowling, the staff epidemiologist at University Health, says stopping offers the most risks.
The more you can have less interactions with other people in crowded spaces, the better off you're going to be as far as reducing your risks.
Do that by mapping out the route you'll be taking, packing food as well as water, hand sanitizer and sanitary wipes for when you stop to get gas, and avoiding restaurants. If you have to stay in a hotel, wear a mask in the room, wash your hands frequently, and
one thing probably would be a good idea to take would be some sanitizing wipes, disinfectant wipes, so you could wipe down high-touch surfaces.
Traveling by plane also offers its risks.
The airport in particular is a higher risk area because the number of people is higher. You're more likely to be in congregate settings or closer settings.
You've also got to wear that PPE.
The face mask is still the most protective piece of personal protective equipment you can wear. And you should really have that on as long as you can, for as much time as you can. So only take that off if you absolutely have to.
Consider a face shield too to protect your eyes and make sure the area around your seat is as virus-free as possible.
I would take disinfectant wipes and I would wipe down the armrests and the tray in front of me just to have an additional layer of protection that I disinfected it myself.
Dr. Bowling says if you haven't decided whether or not you're going to travel, you can check the CDC website for the number of cases and the positivity rate for the area you are considering so you know more about the virus spread there.
From start to finish, vaccine development is a lengthy process using science experiments, animal studies, and human studies. University Health doctors revealed just how long it normally takes to get a vaccine.
When people talk about trials for vaccines, there are generally 3 phases. Phase 1 studies are usually very small, using about 20 to 50 people.
You give different doses of either a vaccine or medication to make sure that it's safe, that people don't have a lot of side effects, and at what dose you start to see some of those side effects, that you have a good idea of what dose is safe to take.
Dr. Jason Bowling with University Health System says phase 2 studies uses a larger number of people, about a few hundred.
You give them the vaccine, and then you look to see how effective is the vaccine or the medication. And again, you're studying that safety signal. Are they having any side effects?
Phase 3 studies are the longest, using one group of people who get the actual vaccine and comparing it to another group getting a placebo and looking at the side effects in both.
That's where we have the highest number of people that we're studying with a vaccine to make sure that, again, that it's effective, but also that it's safe.
And the last thing you want to do is rush vaccine development.
If we don't take the normal process of going through these phase 1 through phase 3 trials, what you worry about is that you may have something that looks good in a lab experiment, but you're not sure how effective it is in people.
But because of the pandemic's global scale, vaccine developers have started producing before the trials are even over.
They're producing vaccine right now, so that if the data comes out from the trial showing it's effective and safe, there'll be vaccine product available.
For the 1918 flu pandemic, there wasn't a vaccine for 15 years, and groups that continued to have mass gatherings had higher numbers of deaths. That's why even when we do get a vaccine, likely at the beginning of 2021, we'll still have to keep wearing masks and socially distancing for several months after.
We've learned a lot about the coronavirus since it hit the United States earlier this year. Here are some ways outcomes are improving, even as new cases keep coming up.
Even though University Hospital says they have not seen an uptick in hospitalizations, they have seen hints about a possible upcoming surge, which is why learning more about the disease is so important.
We still don't have easy to give outpatient therapies, but we know more about the disease.
Dr. Thomas Patterson, the lead COVID-19 infectious disease clinician at University Hospital and chief of infectious diseases at UT Health San Antonio, says more knowledge about the disease has allowed more patients to stay at home.
Increasingly, patients can get diagnosed and stay at home, but then we're seeing patients with more progressive symptoms need to get admitted to hospital.
Studies of remdesivir here in San Antonio have also improved the effectiveness of the drug.
It showed that remdesivir produced quicker recovery times, and even though it wasn't powered for mortality, the mortality was about 30% less.
They've even found ways to help patients breathe easier while in the hospital with simple techniques.
We have learned about some other adjunctive measures that seem to improve outcomes. So proning or turning on your side or stomach or front helps, and some patients produce better outcomes.
This multi-pronged approach has also decreased mortality rates.
I think the mortality rates here in the U.S. are substantially less than we've seen in other parts of the world.
Even though it appears that mortality rates from the coronavirus across the world have gone down, we still don't have a vaccine, so we must continue to wash our hands, socially distance, and wear masks.
I'd like to welcome you to our panel discussion, virtual style. Instead of a round table, we're gathered around keyboards, and I'm joined by Dr. Tom Patterson, Doctor of Infectious Disease at UT Health San Antonio, Dr. Jan Patterson, Infectious Disease Doctor and Specialist at UT San Antonio, and Dr. Jason Bowling, Hospital Epidemiologist at University Health. Doctors, thank you so much for joining us. I want to begin with you, Dr. Tom Patterson, Chief of Infectious Disease at UT Health. A lot of times we're hearing the term pandemic fatigue, and with the public, it is getting difficult being at home and practicing this social distancing and some of the precautions. How is it on the healthcare end? I want to know from your perspective and your colleagues, how are all of you dealing with pandemic fatigue right now?
Yeah, I think that's a real important issue. It's been a long haul. We knew from the beginning it was going to be not a sprint, right? We knew it was going to be a marathon. We didn't know it was going to be an ultra marathon, maybe, right? So that's kind of one of our issues from the healthcare side too. We've had to readjust our whole way of thinking to basically realize we're still in this. We've still got to do our same procedures. And hospitals now are opening up to do their regular work. People are still getting sick with their regular things, and they're having to get operations and procedures, which they should, but it really makes dealing with the pandemic even more difficult.
I think one of the most important motivators in this wear the gown is our relationship with University Health and trying to encourage folks to be better stewards of their health. Do you think the pandemic, and I'll direct this to Dr. Bowling, makes this more difficult? Are people more apprehensive to get pains and discomforts checked right now?
Yes, absolutely. So as you know, one of the things that we're always promoting is that people get their normal screening processes for cancers and things like that so that they can be addressed when they're early, not late stage. I was having a discussion with a gastroenterologist who was very concerned now that we're seeing the number of cases come up again, because they already have a challenge trying to get people to get their screening, which is really important, so they can identify cancers early, polyps, remove them before they become cancerous. And with the initial kind of peak that we had back in July, they were seeing nobody coming in for their follow-up screening appointments for understandable reasons, concerned about COVID. And so with these increasing numbers that we're seeing again, he's again worried that there's going to be a delay in people presenting, and now presenting with polyps instead of being precancerous, but they may already be advanced to cancerous stage. So definitely delays there are a concern. We've also seen patients that have run out of their insulin for their diabetes. And so they've come to the emergency department, the hospital, with uncontrolled diabetes, which can put you into a life-threatening acidotic state. So there is significant concerns for interruption in the healthcare, the normal healthcare maintenance that people need to keep them out of the hospital, to keep them healthy and productive and active.
Early on, I remember hearing that part of the spread of this and really the conception of this pandemic was human behavior and world travel. How important is it that we as travelers really kind of limit that heading into the Christmas holiday?
Well, I think it is important to, keep our guard up, and we have to remember that when we do travel, there is a risk to others and to ourselves, again, because of this asymptomatic spread. And even though, wearing a mask, we all need to do whenever we go out, but it doesn't completely protect us. If there's a large crowd, some aerosols can be expected to come out from around the mask. The virus can enter through the eyes as well. And so, we just have to be wary of all those kinds of points of entry, especially in large crowds, which can happen when you travel.
We have a phone number for you so you can get started receiving real solid information about your health. It's 210-358-3045. Now you can also head to the website wearthegown.com. We're all piling on the hand sanitizer right now, but some sanitizers may be doing more harm than good. The things to look out for to make sure the product you're using is not toxic. Tens of millions of Americans travel for the holidays. This year, that number is expected to be substantially lower due to the coronavirus pandemic. Jeremy Baker takes a look at how to stay safe if you do decide to hit the road or the skies.
We are used to hearing a maximum of 10 people for any gathering, but instead of thinking of it as a number like that, think of it in terms of layers of risk.
Each additional person that comes in adds to the layer of risk. Adds some risk because those people coming in potentially could be infected and increase your risk of transmission.
Dr. Jason Bowling, the hospital epidemiologist for University Health, says even with family and friends, you need to stay vigilant.
We tend to drop our guard around people that we know, love, and trust, our family and friends. So we all want to see our family and friends this holidays, but we have to recognize that risk of transmission is really there.
And don't rely on rapid tests to clear your guests beforehand.
If you're asymptomatic and you get a rapid test, you can get a negative test that might be a false negative test. You could still have the virus, but have this false negative test result, which could give you a false sense of security.
If you do have any guests over for the holidays, stagger the times people are eating. Wear a mask except for the time you are eating or drinking. Try to have your guests outdoors and avoid all buffet-style meals.
There's also more time that people may have their mask down while they're eating over the food that's being shared. And so there's more risk that those respiratory droplets could be in the food or on the handles and that people could transmit infection that way.
But if you are having any guests over who are traveling, Dr. Bowling says be prepared.
If someone is going to be staying with you, you need to have a plan of what to do if that person or yourself gets sick during their stay, because then obviously you've really increased the risk that somebody else is going to get COVID-19 as well.
Dr. Bowling says with a vaccine not that far away, the best way to enjoy the holidays this year is to Zoom or video conference so you can hug later.
So many hand sanitizers on the market, it is a little hard to tell which one is best. We're going to show you how to determine if the sanitizer you're using is helpful, hurtful, or even toxic.
To be a good hand sanitizer, it needs to have the right ingredients and the right amount of those ingredients. But if you end up with a hand sanitizer containing methanol and too much of it ends up in your body, it can make you very sick, and in some cases, it can even kill you.
If you look at the ingredients and on the packaging for the hand sanitizer, if it has that 60% or higher of ethyl alcohol or 70% or higher isopropyl or isopropanol, you'll be good.
Dr. Jason Bowling is an infectious disease physician and the hospital epidemiologist at University Health System. He says you need to watch out for sanitizers with methanol.
Methanol potentially could go through the skin and cause symptoms. And in the worst case scenario, if a small child or an adult intentionally drinks the alcohol-based hand rub with methanol, they're at risk for methanol toxicity.
Some of the symptoms of methanol toxicity include nausea and vomiting, headaches, blurry vision or even blindness, seizures, and if ingested, could result in death.
If someone were to drink alcohol-based hand rub that had methanol in it, it can reach peak levels in 1 to 2 hours, so a really short time frame to have high levels of methanol in the body, which could potentially be fatal.
But when you find that safe sanitizer and use it, you've also got to make sure you're applying the sanitizer often enough.
FDA recommends that if you have hand sanitizer that makes claims that aren't true, such as this will protect you for 24 hours from COVID-19, that you should look at that with some skepticism. This is probably not an approved product.
Dr. Bowling also also says you can check the FDA webpage to find out if the hand sanitizer you has fraudulent claims against it or contains methanol. We'll have the link with this story on KENS5.com.
Welcome back to our Wear the Gown panel discussion. Joining us is Dr. Jason Bowling, hospital epidemiologist, University Health, as well as the Doctors Patterson. It's Dr. Tom Patterson, Chief of Infectious Disease, UT Health San Antonio, and Dr. Jan Patterson, Infectious Disease Specialist, UT Health San Antonio. Thank you again for joining us, doctors. I want to talk about the trial and the trials that are undergoing at UT Health San Antonio. How are things going?
Well, the trials at University Health in partnership with UT Health San Antonio have really gone well. We've been able for these inpatient trials, in other words, patients who had to be admitted to hospital, to really enroll a large number of patients over these months of the pandemic. We were early participants in the trials that led to approval of remdesivir, something I think our community should really be proud of, that our research teams and our clinical partners were able to stand up these trials really quickly. And our patients should really be commended. It's the sort of spirit of San Antonio, right? We want to serve. We want to do our part. Obviously, people wanted to get drugs that made them better, which I think they did, but they also wanted to serve. And so it's led to approval of new therapies for this terrible virus. And it's included a number of really high-risk, vulnerable patients. Our Hispanic community has really been impacted in a disproportionate way in large numbers. And fortunately, our patients were able to participate in these trials. And so I think that's something we should also be proud of in this pandemic.
And Dr. Jan Patterson, are you encouraged by what you're seeing in these trials and getting us closer to not a cure, but normal?
Yes, very much. Several months ago when all this started, we really didn't have alternatives and we didn't know what medicines to use. There were some false starts, with like hydroxychloroquine. We learned that wasn't really useful. But then with these ACT trials, we've learned remdesivir was beneficial if given early. We've learned steroids are beneficial if given in the right way. We've learned that baricitinib, which is a new drug that just got EUA approval, is very helpful as an anti-inflammatory in the later phases of severe COVID. So we have a lot of options now. We've seen the hospital mortality rates go down. And so I think that's very encouraging. It's great to have options for treating these severely ill patients. Where we can still make some inroads is in outpatient treatment. We have the new EUA for the monoclonal antibodies, and that's one thing that will be helpful. There are some logistical issues with it, and we're working on that in terms of how to give it in the outpatient setting. But that will be one thing that will help us in outpatients. But then, oral medicines, thinking about what oral medicines would be beneficial. Those are still some areas of research that need to happen.
How close do you feel we are to seeing this vaccine widely available?
Well, I think that it will be, mid-December, very soon. I think that the distribution plan will be to get it out as soon as possible for those who are most at risk. So I think we can look forward to this as a Christmas present, to some of the community. I think we will see the first doses in December.
How do you feel the city and the community, the state at large, will receive news of a vaccine? I see it on social media a lot, people asking each other, when a vaccine's available, will you take it? How do you feel the communities will begin receiving this news?
Yeah, I think that's a great question. And so obviously there's always the issue of vaccine hesitancy, people that are concerned, and it's understandable concern too. These are new vaccines, right? I think the good news is that they have gone through the trial process. There have not been shortcuts as far as monitoring safety, in addition to how well they work, because really the safety is the key thing I think everybody's understandably concerned about. I think as they go through, initially there might be some people that wait to see some people get it initially, since there will be some smaller amounts initially. I think the healthcare providers that are seeing COVID patients will receive it first. And so hopefully that will allow more people to see that they're receiving it safely, and that will increase the buy-in. I think it's going to be important that we continue to kind of demonstrate the safety of these vaccines. They're going to continue to study these even after they've been approved to make sure that there aren't any new signals that would worry anybody about, giving these out safely. I mean, vaccines are one of the most studied interventions that we have, really even more than medications that people buy over the counter. Vaccines have ongoing monitoring. People report adverse events. And so that safety monitoring is not going to stop. I will say that I'm planning on receiving the vaccine when it's available, but I think we need to kind of demonstrate the safety of these as they're rolled out.
We want to help you get started on a path to good health. Call 210-358-3045 or go online to wearthegown.com with your health questions. Still ahead, they are among the most vulnerable during this pandemic. The extra steps maternity wards are taking to protect expecting mothers and newborns when labor begins. Recovering from the coronavirus is a battle within itself for so many patients. But when your immune system is already compromised, it can be even tougher. Jeremy Baker finds out what getting coronavirus could mean for kidney patients on dialysis.
Kidney patients on dialysis have a lot to think about when it comes to the coronavirus, both at home and when they go in to get their treatments.
If you look at the data currently, I do not know any patient in our dialysis unit or in the rest of the city that they got infection from the dialysis unit.
Dr. Shweta Bansal is a nephrologist with University Health System and an associate professor of medicine at UT Health San Antonio. She says even though no dialysis patients have contracted the disease in a unit, they still need to be careful.
You want to make sure that in your unit, everybody is wearing masks. Your fellow patient who's sitting on 4 to 6 feet away from you.
Dr. Bansal also says diabetes plays a big role.
Diabetes is very, very prevalent in this area, which is the biggest risk factor for the chronic kidney disease and leading to dialysis.
In the U.S., there are over 500,000 dialysis patients. About 46% of them are on dialysis because of diabetes. Here in Texas, we have 10% of all the dialysis patients in the country, but a whopping 75% are on dialysis because of diabetes. Dr. Bansal also says those patients, especially if they have diabetes, need to be extra careful at home.
Having a small outdoor gatherings, keeping a distance of 10 feet or wearing masks is still feasible. You can do that.
Dr. Bansal also says that if you know of any family member who may have been exposed to the virus, to keep them away from any dialysis patients who are more vulnerable to catching that disease.
We're now close to a year into the coronavirus pandemic, and we continue to learn more about how the disease is spreading. Here's what University Health is doing to keep expecting mothers and their babies as safe as possible before, during, and even after childbirth.
For an expectant mother, childbirth can be one of the most stressful things on the body. Adding coronavirus into the mix can take that stress to a much higher level.
I can't emphasize enough how important it is for social distancing, mask wearing, good hand washing, and avoiding being around a lot of other people when it's not necessary to do so. That's no different for pregnant women.
Dr. Sarah Paige Ramsey is an obstetrician gynecologist within the University Health System and professor and the OBGYN residency program director at UT Health San Antonio. She says in-person baby showers shouldn't even be a consideration.
They're having virtual baby showers that have actually been a lot of fun. They can still play baby shower games, show pictures, videos, share gifts, open gifts while they're on a virtual conference with all of their friends.
When it comes time for childbirth, there should be no fear of the hospital.
We want to encourage all of our patients to keep in mind that the hospital has taken great precautions to make sure that the risk of infection is very minimal and probably, more minimized than in a lot of other settings.
They even allow a support person to be in the room at the time of delivery.
We would recommend wearing an N95 mask as well as a face shield, full gown, and gloves to help prevent the spread of that infection.
And after the baby is born within the University Health System, the mother and baby can still bond.
As long as mom has a mask on and we're following good hand washing, our policy here is to allow the interaction to take place between mom and the baby and her support person and the baby throughout their hospital stay.
Dr. Paige Ramsey also said that if a woman has coronavirus while pregnant but then recovers, there's been no evidence that there's been any developmental issues with the child too.
We have a phone number and a website, both dedicated to health. To get started on a lifetime of wellness, call 210-358-3045 or go online to wearthegown.com. Thank you so much for joining us. We certainly hope you enjoyed our special. But more, we hope it'll encourage you to get healthy and be more aware of some health issues. On behalf of KENS 5 Television and University Health, I'm Bill Taylor, reminding everyone to wear the gown.